Welcome to an episode of Circle of Wellbeing by Union Assurance, a program dedicated to enrich the well-being of all Sri Lankans. In this fast-paced world, prioritizing emotional well-being is important for personal growth. Although motherhood is considered a sacred phenomenon worldwide, postpartum depression is often overlooked. In order to address this issue and raise awareness, we have invited Dr. Buddhi Jayasekara, Lead Consultant Psychiatrist at the Teaching Hospital Kuliapitiya, to join with us on the show. Welcome to the show, Dr. Buddi. So, Dr. Buddi, what is postpartum depression and how does it differ from baby blues?
The baby blues and the postpartum depression has their own differences, one on the intensity and the severity as well as depending on the duration. So, postpartum depression is a much longer, severe as well as something which takes a little longer time to recover. Whereas the maternity blues, or what we call baby blues, has the onset on the initial first 3 days and then it lasts only for 2 weeks. Whereas the postpartum depression itself, that starts little later, somewhere around 2 weeks, and might even go up to 1 year. And roughly what we say is generally roughly it stops around 9 months, but still it goes up to 1 year. And the most important part out of all is like the maternity blues or baby blues is a sort of something which is very common, which we tend to say almost 80 to 90% of the mothers have a sort of a slighter or much moderate level of maternity blues, which is natural in the sense, you know, when I have a kid, I will feel that whether I'm fit enough, I'll be anxious. I'll be anxious about how I would care for the child because it's a lifelong thing. So basically they will be anxious about whether am I fit enough to look after the child. Especially when it's a primary first term mother, she might feel as if, am I competent enough? I have no experience in this. And added to it, there will be certain others who will be putting their own ideas about how to breastfeed and what not to do, what to do, and so on. So that anxiety itself, as well as bit of irritability which comes out of more physical reasons, like estrogen and progesterone, which are the main hormones which we have in our body, will be changing rapidly during that time. It will be reducing, and as well as certain other hormones like thyroxine and all that. So that physiological phenomenon itself will bring up a change in mood. There will be certain fluctuations in the mood, so you will feel a bit irritable at times, especially would be directed to your husband maybe, or probably your own mother or somebody very close to you. But they will feel a little different, and you will feel, if it was me, I will feel a little awkward towards what's really happening around me. And then again in maternity blues, they will have certain difficulty in sleep, not completely sort of loss of sleep, but some kind of a difficulty in sleep, which is natural, where the child will be crying, the newborn baby will be crying often, and you need to feed him maybe 2 hourly or less. So that will have sleep differences, sleep difficulties. On top of that, they will have eating difficulties, so they might not feel as if they have a good appetite, and during that time you will have certain physical difficulties as well. After a normal vaginal birth, they will have pains, and especially some mothers tend to get tears also, but on some others we might have to put a small cut, and that is painful. So the pain also triggers certain emotions, certain difficulties. So that's why the maternity blues or baby blues are sort of a natural phenomenon, but might get into a much severe situation where it might be the onset of maternal depression or postpartum depression as well. So in terms of postpartum depression, if we say, like, given that that would be much severe, most of these will be much severe. The fluctuations of the mood would be really high. There will be very high peaks and quite a lot of dips also in between. So you will cry often. Now, given my experience with mothers whom I see, in fact, I would try to give an example from the mother whom I have seen yesterday. That mother was telling me, or rather I asked, because this is the question which I asked from them, do you feel that you feel comfortable to leave your child to rest with one of your nears, maybe husband, maybe somebody very close like your mother, and have a good nap, a bit of relaxed nap? Generally, postpartum depression, in that case, you feel quite anxious to leave your child with somebody else even. So they won't be able to sleep, they won't be able to have a natural sleep, and won't even be able to leave the child and go for your own activities of daily living, may it be for a wash and so on. That's a little severe. And then they will have sleep difficulties as well, and eating difficulties. At the same time, they feel as if they are not doing a good job. They feel as if I'm not bonding with the child enough. In maternity blues, you will get a little feel of anxiety about the bonding, but you won't feel that you are not a successful mother as such. So, but postpartum depression, you feel as if you are not a successful mother. I'm not going to get successful with this. The baby is not feeding enough. I don't have enough milk. That was a common sort of common idea around, especially primary mothers, that okay, I'm not producing sufficient milk, was maybe given that certain their near and dear relatives, mostly grandmothers and her own mother, will tell her, okay, probably you're not making enough milk and you need to give more milk and so on. But that anxiety is different from what you get in postpartum depression. In postpartum depression, they tend to feel as if, yes, whatever they say, I'm having a sufficient amount of milk, I'm not good enough mother. I can't look after this child. The bonding is poor, and maybe to a certain extent, the postpartum mother will feel as if they need to do something to harm themselves, even to kill themselves, not each and every, but in a severe cases, they tend to get there.
Dr. Buddi, how common is postpartum depression and who is at risk?
Postpartum depression is much common, and common among the general public as well. So you tend to see various mental illnesses, but this is comparatively common, and that's the most important part as well, given that we are looking at two people, the child as well as the mother. So the risk is equally important to look at. So a mother who has a risk should be identified as early as possible. May it be the family members even. It's like, one, the mother might have a physical illness, which includes fever following childbirth, which might be following the tears, or even the cut, the episiotomy, which we put on a mother to take the child out easily. And then again, there would be other urinary tract infections and other infections, may be related to the hospital-borne infections, because in a hospital you will have various other germs. But other than that, there are certain other risks like past history of previous depression, or past history of maternal depression or postpartum depression itself following her previous childbirths, or even related to genes like a family history of depression, even family history of suicide. So all these will direct them to have a higher chance of getting a maternal depression or for postpartum depression. There are certain other factors like generally the consensus says, or the research says, that when a mother is a teen mother below 20 years and with a lot of family conflicts, domestic violence and others, will also have a higher risk. And even to a certain extent, when they underwent certain procedures for infertility, artificial insemination or others, where they were quite anxious about the current child, which is because it's a precious child, of course. So that also increases the risk. And there are few other things like when you have financial difficulties, especially in these current contexts, they have a higher chance of developing postpartum depression as well.
What are some common myths associated with PPD or postpartum depression?
That was an excellent question, because myths are the commonest things which we find in the society and which are the ones which hinders prompt treatment and thus will have significant effects on the child as well as the mother. So the commonest which I find is, let me put in perspective where I tend to see patients, they come and tell me, I feel I'm a very bad mother. I can't look after my child well. I don't get that bonding and I can't feel for the child. I feel as if I might be better off if I didn't have the child. So those are the things which comes in postpartum depression, and they feel quite bad about themselves. And in turn, in the society also, sometimes people will say, how can you think about your child like that? And that also induces the feeling of having that I'm one of the worst mothers. So I should not tell that to the doctors or even my near and dear, because people will look at me as a bad mother. That hinders the treatment, that hinders them coming to us, coming to doctors and telling us that there is problem like this going on. So number two is that people or general public generally think that we might be able to get out of that feeling by thinking better or looking at the things differently by your own self. Why don't you think like this? Why don't you think that your baby is very important? You will have a better life. So just think and get away. But it doesn't happen that way. As I have told, that there are physiological changes, hormonal changes. Plus, if you take the brain, more in the frontal area of the brain, there is significant changes which had been clearly shown by the research. fMRI studies and certain studies have clearly shown that they have a different, I'm not going to go into more technical details, but significant different changes in the chemical structure. So you need to have treatment which in turn will be getting that sort of the change out clearly, and out of which the mother will improve significantly. Other things are certain myths like, now this is because of the incompetence of the mother. That mother couldn't give enough milk, mother couldn't sleep enough because she was an incompetent mother, which generally comes from the other people, but at the same time mother will also think like that. Not because I was being practiced or I had a previous experience of having a child, but just because I don't have enough skills to look after the child or had that bonding done. So the third factor, which is quite important as well, is that the mother should not be given the baby. She might very well harm the child. That's another myth, that when they were diagnosed of postpartum depression, that the other people will feel, or maybe unknowingly, even the medical person, some doctor or another colleague of somebody might tell her that, okay, there might be a threat to the child, so don't give the child to the mother. If at all, it's like having a total security around the mother when the mother is handling the child, which is not good, and it's a real disadvantage for the mother and the baby bonding, or the initial attachment, what we say. So basically that is also very disadvantageous for the mother's recovery from the postpartum depression. So we need to change that, and thus if we do know the myths related to this, we will be able to care for the mother as well as give them a better life, better child and maternal bonding, which will in turn take for their own lifetime. The child's life and the personality depends on that initial bonding. So it's very important to understand those myths.
So Dr. Buddi, can postpartum depression impact both the parents, and how to mitigate the development of PPD with family interventions?
That's again a very important and much left out topic, because the postpartum depression, we look at the mother only, we concentrate on the mother only, but it affects less fairer sex as well. So the father, these are proven facts out of research that which I am telling. The father will also get part of the depression, and they can go into a significant depression as well. And mind you, there are enough research to say, enough evidence that day in, day out, I tend to see certain fathers who tend to get this feeling of excessive bloating, difficulty to eat, putting on weight, and at times headaches, vomiting and all that, when the mother, his partner is also going through that. There is in fact a name for it, it's called Coady syndrome. So it was well documented that the fathers tend to get the same or almost similar symptoms during that time. The same applies for the postpartum depression. When the mother is getting irritable or having mood swings, the father also tends to get it. And mind you, the anxiety related to child rearing as well as about the competence, it's shared. So it's a common thing that father will also feel the same. So the other very important thing which you asked was how to get through this through family intervention, because we don't talk to each other. The communication is less when it comes to this sort of things, especially less fairer sex. The males might not tell others about what is happening to them, how they feel. It looks as if they are quite incompetent in handling. So they might not, and in turn they will have anxiety and even irritability towards other people, and they might lay low, they might not work well, they might not go to their usual job even, and the other extended family might notice him as if now he's not doing necessary interventions or necessary earnings for another mouth to feed. So it becomes another difficulty within the family where he was blackguarded, and then the mother who is affected from the postpartum depression will in turn have a significant outbreak of the depression also. So what I generally do is I take them all. I tell them what is happening. This is a new adventure in life. Take it as a new experience. Learn from it. Discuss with other medical personnel. May it be midwife, may it be MOH, or even a relative who has better experience. So that family intervention will always have a significant effect on how to get through this difficult time. And it's a joint project rather than the mother's or father's or somebody else's. So when it becomes a joint project to be successful in this child rearing and the new adventure of having a child, one will help the other rather than keeping things bottled up. So family intervention in the sense would be rather letting them communicate with each other about their difficulties, about their challenges as well. And again, for the fathers, what I tell them is get used to going for classes which they do in the prenatal period or pregnant period with the mother. Of course we go, but we don't listen. So we don't join those classes to know what is happening. So I in fact encourage them to go there initially, and then I encourage them to get along with things that they do naturally or generally, like exercise, eating a balanced diet, and evaluate your relationship with alcohol and other substances and prevent having any of the substances as much as possible, avoid them, and generally to have that physical activity also involved. So when those things do happen, the paternal or father's mentality will be good. So he will support the mother, and in turn the family will recover completely, rapidly as well.
What are some effective therapies or treatments for postpartum depression?
Yes, postpartum depression has quite a number of therapies depending on the severity. So it might be mainly psychological, or it can be a combination of psychological, physical, social interventions and family interventions. So the milder forms might need more psychotherapy. In turn, I wouldn't put it more in technical terms, psychotherapy in the sense having an understanding about what is going on in their life, in their mind, and even their close, near and dear. So when they do understand that this is a natural phenomenon, but I'm getting it in a different way, they can and we can modify their thoughts in a way how you will feel it. But always there should be a significant communication, sort of a significant way of expression. The mother can tell us what sort of emotions are really going through, So that really needs all these myths out of the window. When they don't have that, they will tell you or tell the midwife or any other health personnel about what is going on. And then we can slowly express to them or explain to them the way how thoughts should be modified. So that's what we call cognitive behavior therapy. Cognitive behavior therapy alone can help in certain matters, but some, when they come into moderate as well as severe, you might need medication also involved. So there are enough evidence to say successful medications are there, and there are newer medications which are coming in now. A recent drug was approved by the FDA, United States, and it will be coming to Sri Lanka also. And there are few others which had been time tested. They had been given and had been successful, and the parents need not to fear about any difficulties which they will face by having it to breastfeeding or the drug going through the milk to the baby. So there aren't any significant side effects from some of these drugs. So there are enough and more evidence for medication as well. But as a whole, each and every mother will have certain social interventions as well, which involves the family. As I have told in the very beginning, the family interventions, getting the family to know what is happening, explaining the family how they could help. For instance, now if I tell you like about a recent example which I found about a mother. Now the mother was initially eating more than what she used to do, and the father was saying always, why are you eating this amount of food? Can you gobble all that up? And then again they have been commenting on her weight, saying that, do you think you have twins? And all these had been ruminating in the mother's mind repeatedly, and now she is quite worried when the first child was born even, that she might be changing her outlook, she might be having a difficulty in reducing her weight, as well as that she might develop on subsequent pregnancies, she might develop obesity and significant weight gain. It's a mild thing if we look at it, but this is the thought which had been ruminating in her mind repeatedly, giving her she in fact had postpartum depression related to some other factors as well, but this is also one of the major factors which had been contributing to her postpartum depression as well. So life is quite easy once you get to know about the treatment and knowing that there are significant successful treatment methods are there, and you just need to ask for help.
Dr. Buddi, are there any lifestyle changes or self-care practices that can help reduce the symptoms of postpartum depression?
Of course, there are. They can do significant lifestyle changes, which includes getting back to their normal life. Now, for instance, the mothers and the family will not allow the child to be taken into the public places, thinking that the child might cry. How can we face the crowd? Or even to the doctor, given that they will cry out loud and they won't be able to discuss things with the doctor. Or getting used to feeding in public, because when you are outside, there are times that the child gets hungry, so you need to feed them. So you feel awkward related to feeding in public, and sometimes about the difficulty in taking the child to outside related to the child getting some of the germs, some infections, or the assessment of their competence in handling the child. There was in fact a mother who was really worried that she might topple the baby, so she didn't take them. So that restricts your recreational activities, your general lifestyle. So that itself will have a significant impact on getting back to your natural self, normal self. Other thing is the physical activity. For instance, now we don't advocate mothers to start physical activity. So we go with the 5-5-5 rule, where the first 5 minutes would be in the bed, where the child will be kept in the bed and mother will have necessary bed rest as well, especially when the mother had undergone a severe normal vaginal delivery or else emergency or elective cesarean section. The mother needs to get back to her usual physical self and she needs significant bed rest. So we advise the mother to be in the bed or around the bed and get that physical strength back. And the subsequent 5 days, you advise the mother to keep the child on the bed and be around the bed only. Then she will not be having the need of weight bearing, where you have to carry the baby around, and at the same time you need not to have that unnecessary rest to your legs or the body, where you might develop certain difficulties like blood clot formation or anything else in that perspective. So we really advise them to be around the bed during that time, and then the subsequent 5 days we advise them to be around the house but not to do too much weight bearing, as well as getting used to your normal self gradually. And during that time your womb will get back to your usual level as well, not completely but to a significant level, and the body blood volumes and all other things which had been increasing during their pregnancy will also get back to their usual levels, which make your life much easier. You won't get excessive exertion or you won't get excessive short of breath during those days if you go on that line of 5-5-5 rule. So doing all that, you can easily get back to your usual self, and at the same time it's very important that you need to get a balanced diet. Now there are certain mothers whom I find that their parents, their mothers or grandmothers do not allow them to bathe, which is to say that you should not do that during that time, which will be bad for the child. But it's very important to have a good hygiene during these days, especially when you have certain ulcerations, certain tears and other difficulties. So getting back to your usual self, normal eating habits, normal physical activity, as well as if possible to your general interested recreational things. May it be reading a book, to may it be something like a small jog or a walk. Depending on your medical advice, you can always get back to those, which will in turn make your life easier, which will in turn make the child's life easier of getting that attachment, and the family will be happy and much more united. So it's a very happy sort of adventure when you include all these lifestyle modifications into your life as early as possible.
So, Dr. Buddi, how can healthcare providers and communities better support individuals with postpartum depression?
Yeah, it's again one of the most important questions that you have asked, because it's more or less a community thing. It's more or less, it's a family thing. So it involves the bigger public. You know, a childbirth will in turn bring a lot of people into that that life event. So as healthcare providers, we have established a certain level of care where it starts from the midwife, because she was very close to the mother from the very beginning, and as such the mother can always go to or call the midwife and explain to the midwife what sort of things are going through their mind. And in turn, the healthcare provider, may it be midwife, may it be MOH, may it be the gynecologist, or even a family doctor, can inquire certain things from a mother, which we generally encourage them to. When the mother comes after or in and around 2 weeks, we inquire certain things about how they feel, how do they feel competent about, and what sort of things they feel that they can't do well. So that gives us a good idea about whether are they going to a phase where they are getting depressed. And even certain anxieties, because people always think like, okay, depression is something where they will just lie low, do not talk, do not do anything and sleep throughout the day. It's not so for postpartum depression. Since I was telling throughout that there was this anxiety underneath. So they might be restless also at given point, and all the family members and even the medical person might just advise her not to walk around, not to be too restless about. So if we inquire them about what is going through their mind, and they will all of course tell us about what sort of difficulties are running through their mind, what sort of things are disturbing their usual life. So we start from there, and then about the public or the community, what we can do was like getting the mother embraced into usual lifestyle. Ask the mother to get back to their usual functions. May it be almsgiving, may it be something like a wedding or a party even. Don't leave the mother at home and go for it. Like, embrace her, support her during that event so that she can have a sort of a good time, as well as looking after the baby is also possible. So that competence that I can take the baby anywhere I want, and there is this community support which is coming in, rather than telling them, why did you bring this newborn baby to this event, which might help them very much. You know, like there will be extreme development of competence, as well as the feeling that I have so many others who are happy to help me, not that I am alone. It's a kind of a feeling that you can't explain in words. And other thing is like now we are not really up to this, because the midwife or the healthcare providers can get these well baby clinics where mothers will come with same age babies and they discuss among themselves. It's sort of what we call a meeting of mothers. How do they handle certain matters? May it be looking after the child, may it be something related to their family life. because they need to get back to their own usual pattern of life. So, might be better to get it from another person who's undergoing the same experience rather than somebody else or a healthcare provider just coming and telling you do A to Z. So, that also we really encourage when they wanted to have these interventions. And so, at the end of the day, it's what we are looking at is quality of life for the child, mother, and to the family, and for the country as a whole as well.
Thank you, Dr. Buddi, for sharing those valuable insights with us.
You're most welcome, and thank you for Union Assurance for this valuable task of looking at the general public, enhancing their health.
I'm sure our audience has greatly benefited from the comprehensive review about postpartum depression. Stay tuned for more episodes.